Pain and discomfort at our tailbone can be so nagging and irritating. And sometimes it can be because of an injury many years ago, but it still holds that tension. Sometimes the tailbone is a little bit turned or torqued one direction or another. So for this exercise, we're gonna find our tailbone, which a lot of us don't really have any awareness of. So I wanted to point it out on my pelvis here. Here's kind of the front of my pelvis and the two sides of the ilium, one of each on each side. And then this is looking at the back of the spine here, where you have that big bone called the sacrum. And then very close, as you keep coming down the sacrum, you'll feel your tailbone. So if you find that structurally, you may feel that big bone to the sides here, and then walk your fingers down and you'll feel the edge of that tailbone. And this exercise for our tailbone is we want to palpate around the tailbone and notice which side has a little bit more tenderness or maybe pain. You don't have to push too hard, but just sensing the tissue. Maybe it's a tissue feels a little bit more stuck or has more tightness on one side. That will be the side that you want to work with. So there's two steps to this. The first is finding that coccyx and the tender side, and then whichever side is the side you're going to work with, find the same side wrist about 1 to 2 inches up from the wrist, anywhere in those bones or that tissue. You're going to search around for a tender area in that place. And it could be on the bone, the radius bone, which is kind of comes down towards the thumb, or the other side, which is called the ulna. So anywhere in there, you might feel, oh, that's a little tight, or maybe has a little tenderness. Those are the 2 points that we're going to use. And to do this exercise, it takes a little bit of finagling of our arms around our body. And I'll give you an option if that's not possible for you. But what we're going to do is have one fingertip on the coccyx and the other fingertip on that tender place in your wrist. So to set up, you're taking the affected side and you're bringing a finger, I'm going to use my third finger, to that tender area of the coccyx. Then I'm going to reach around with my opposite hand and come to the tender place on my wrist. And the exercise here is to gently either hold those 2 points, and sometimes just holding them very gently brings them into a connection that helps to release the tension around the coccyx. You also might try to do just a little gentle pressure, maybe for 2 to 5 seconds on the coccyx, and then gently release that pressure, and then squeeze gently around the wrist for 2 to 5 seconds. So we'll go back and forth here a few times. A little bit on the coccyx and release, and a little pressure on the wrist and release. And you want to keep paying attention to how that feels. If it begins to feel more irritating, then that's enough. If you feel like it's calming a little bit or it's soothing, keep going. And if you have no feeling at all, then maybe you do it 5 or 6 times, back and forth. And then release your hands and notice, maybe after a moment or two, you can palpate again that coccyx area and notice if the tenderness has changed at all. Simply notice what you notice. Maybe you do a little integration with some movement at the pelvis or walk around your space and allow that to settle. And then from there, if it feels too difficult for you to get into that position because of your shoulders or your arms, any other pain in your body, then you can simply imagine, maybe have one hand at your coccyx and simply imagine touching your wrist and feeling that pressure at that tender area, going back and forth the same way, but just thinking about it in your mind's eye. That can also work. So I hope that helps relieve a little bit of tension and ease and create a little more ease in your tailbone and also for the whole pelvis and the lower legs and the spine as well. It can be a great, effective exercise. Thanks for joining me today.